We have some before and afters that I'd like to share with our viewers. If we could take some real quick before we take a break. My apologies. Let's talk about this one. Look at that. Very dramatic.
Actually, this is scalp micropigmentation, which is a different, I mentioned it, this is a non-surgical way to make the hair look fuller. Basically, it's the same concept as a tiny bunch of tattoos, and these tiny tattoos are made like little dots, so they look like emerging hair follicles, and as a result, they create a fuller look. And this can be a quite effective therapy, either in conjunction with the transplant or as a standalone therapy.
All right, let's take the next one and talk about it.
This is, again, scalp micropigmentation. You can see the before and the after, how you see the widened part, and the use of the micropigmentation allows the scalp to look fuller, so you notice less of the hair loss.
Pretty dramatic there as well.
And this is a single procedure. It takes around an hour to 2 hours to perform, and then usually 4 to 6 weeks later. Another example of before and after scalp micropigmentation. Now, this woman subsequently underwent a hair transplant, but first we went ahead and did the SMP on her. And SMP is something that ideally you should have done by someone that really understands, how to do hair restoration, or at least understands normal hair anatomy and the aesthetics of hairline design.
I think we have a couple more before we take a break. Ooh, look at that.
Now, this is a real hair transplant procedure. This is before and 10 months after, around 2,000 grafts, which is around 4,000 hairs. And you can see the hairs will grow in, and these hairs will continue to grow for a lifetime. They're permanent.
All right, we have a few more to go.
This is another example of, this was a younger patient. He had a lot of that miniaturization, so we went ahead and did a relatively conservative procedure because he was only in his early to mid-20s. And this was a procedure of only around 900 grafts done to basically restore the frontal temp recession. Hairs were removed from the back of the head, like the other case in this case, so there's no scarring. So when this individual decides, if and when he decides when he gets older to shave his head, he'll have no problems doing that. You can see the nice outcome.